na, with your stress ulcers or your Curling's ulcer, okay, Curling's ulcer, what is defining here is that it really doesn't choose whether your stress ulcer would be your gastric or your duodenum. Basta meron kang major traumatic event, yun, stress ulcer na yun. Kahit location pa niyan, whether it is, sabi na examples of this major traumatic event will be your head injury, you have your major surgical procedures, you also have your burns. Please remember my discussions for that one. We also have your respiratory failure, even your shock and your sepsis. Pwede po yan siya. These are medical crises or medical emergencies that need to be provided appropriate intervention para hindi ka magkaroon ng complication. Or in this case here, para hindi ka magkaroon ng stress ulcer. Kaya lang kung minsan, na-overwhelm yung katawan natin with the stressful situation that the body is actually experiencing. So, bleeding ang pinaka-principal manifestations ng stress ulcer natin. Hindi na nakayanan ng ating GI or ng ating stomach with the overwhelming amount of gastric acid or even your hydrochloric acid caused by your stress ulcer. So again, multifocal your areas, hindi lang iisa, marami pong areas na pwede ka magkaroon ng bleeding dyan. Usually, yung hydrochloric acid natin is elevated the longer that the patient is confined in the institution and if it's more than 11 days. Mas matagal kang nagstay doon sa hospital, mas matagal kang magkakaroon ng problems for your stress ulcers. Kaya yung mga pasyente namin sa ICU or patients that we are trying to handle in the ICU, usually have your NZT feeding. And a part of the medications in the NZT feeding, we have to combine these oral medicines. One of them would always be your yung mga antacids natin, yung Almag, your Maalox. I even have your medications such as your sucralfate, your carafate. These are important medications which decreases your acidic environment in your stomach or even in your duodenum. So, yan, mga usual na pasyente namin, it's either in your stroke unit or even in your medical ICU, lahat din sila, naka-NGT, tapos meron silang medications, katulad ng mga sinabi ko kanina. What are the complications of your ulcers? Your gastrointestinal bleeding. Okay? Gastrointestinal bleeding. And with your gastrointestinal bleeding, 15 to 25% usually have a history of your PUD. Totoo yan. Mostly na mga pasyente namin sa ICU na nagkakaroon ng complications because of history of your PUD is your UGIB, your upper gastrointestinal bleeding. And yan nga sabi ko, mga matatanda din. We have your elderly patients. After initial bleed, parang for example, naka-recover ka lang sa initial bleed mo, no? However, there's a possibility for 40% of your bleeding to reoccur. Especially kapag wala kang ginawa doon sa problem mo na ugib or problem mo na PUD. Okay? Okay, 40% of patients who have your gastrointestinal bleed will have a recurrence of your GI bleeding after they first experienced it. Of your H. pylori infection, and you did not have any intake of medication such as your H2 blocker or your H2 antagonist. At the same time, doon sa internal hemorrhage natin, hindi lang makikita doon sa could be complaints of your hematemesis. Especially kapag ang gastrointestinal bleeding natin ay nangyari doon sa duodenojejunal junction. doon sa small intestines na talaga. Okay, so hematemesis ang nakikita saan. Now, smaller amounts of bleeding are seen with your melena, especially that ito yung mga ugib natin, upper gastrointestinal bleeding. More often seen in duodenal ulcers. Stool may also appear to be black and taddy. Kaya meron namin doon sa clinical area, kung for example, nagsusuka yung pasyente namin, there is from that hematemesis. Unfortunately, hindi lang yung blood na lumabas doon there is also your parang amount of food na kasama doon sa hematemesis mo. And kung aamuin mo siya, talagang sobrang baho. In like manner, when we are trying to deal, sobrang baho din yan. Kaya if you're going to be taking care of a client who has your ugib, you have to, parang hirap mag-alaga ng mga pasyenteng ito. You need to do a lot of things for them. You need to have your nursing assistant there with you, especially if you're going to change ensure help the patient do your gastric lavage, etc., etc. Okay, so that is for your gastric hemorrhage or gastrointestinal bleeding. Another complication of your ulceration, sabi ko nga kanina, is your perforation. Perforation is nabutasan yung whole layer ng muscle mo, whether it is going to be in your stomach or whether it is in your intestines. Basta nabutasan kasi nasobrahan na yung ulcerations, it has been totally destroyed by your acidic environment or acidic contents. So, ang nangyayari doon, since may butas na siya, there is leakage of the abdominal or your gastric contents into your abdomen, into your peritoneal cavity. Kasama na doon yung kinain mo na pagkain, kaya the chyme there, even your gastric enzymes, if your acid peptic juice, acid natin, yung pancreatic juice na dapat nandoon lang sa duodenum, di ba? Ang nangyayari doon, since nabutasan na yung duodenum mo, nag-leak out itong mga substances na dapat doon lang magstay sa intestines mo. And if that happens, okay, there is a high possibility for your infectious process. You have your peritoneal cavity, meron kang quite protected with your mucous membrane. Kaya lang, since nag-leak out yung mga gastric acid and other gastric contents doon sa peritoneal cavity natin, this peritoneal cavity would be likely subjected to your inflammatory response. Okay? And if there is that inflammatory response, yung buong peritoneal cavity mo, magkakaroon ka ng infectious process. Anong tawag mo sa infectious process na yon kapag meron kang infection dito sa abdominal cavity or peritoneal cavity? Anong tawag mo doon? Guys. It starts with the letter P.
Peritonitis.
Correct. It's your peritonitis. Okay? You have your peritonitis. It's not a cause. You are likely in the cavity. Dapat doon lang siya nagstay sa duodenum mo, di ba? Dapat doon lang siya nagstay doon sa gastric sa stomach mo, di ba? Kaya lang, since there is already your perforation, meron ka na naman isang problema. And that is your infectious process in your peritoneal or abdominal cavity. Sudden sharp pain in the mid-epigastric region, have your perforation. Okay? With your perforation, sabi ko nga, nag-leak out yung abdominal contents or gastric contents, nag-spill out doon sa peritoneal cavity natin. That is why with your peritonitis, ano ang manifestation na makikita mo? You have here, tender, masakit po siya. Rigid and board-like abdomen. Most likely, the patient will be going on fetal position in an attempt to decrease the pressure or decrease the tension of your abdomen caused by that infectious process or caused by that inflammatory response. Okay? Chemical peritonitis, check. Bacterial sepsis, because of that peritonitis that's happening in your peritoneal cavity. Kapag nangyari yan, okay, itong tatlo problem which is your paralytic ileus. Imagine mo, wala ng peristalsis. Wala ng peristalsis na nangyayari dyan. Magsa-stomacal contents. And because this is a progressive disorder, and if you don't do something about that, you will end up dying just because nabutasan yung intestinal lining mo or even your gastric lining mo. Hindi ka naging careful dyan. Okay, so because that is your perforation. By the way, this is what happens when you have yung ulcerations na nandoon lang sa layer. I mean, half of the layer is only affected. But when there is your perforation, tinan mo, lumusot. Okay, nabutasan na eh. Lumusot na dito. Look at your drawing. Gastric content going out would likely cause you to have that inflammatory response and that peritonitis. Okay? That is your perforation. Another complication of your ulcer is your pyloric or stomach. Papunta doon sa duodenum mo. Ngayon, with your pyloric sphincter, ano nangyayari doon? Hindi siya nag-open. Nag-close siya. Ayaw niyang palabasin yung kain mo doon sa stomach mo. Nag-close siya. Sphincter. Parang ang nangyayari except to go back up. Okay? Ito yung stomach mo. And ito yung stomach mo. Sphincter. Okay, that's your duodenum over there. It's actually closed. Would likely result to having your vomiting. Kasi nga, naging stasis, nag-stuck up dito yung food mo. Hindi siya nag-move forward doon sa duodenum mo. And because there is that piling up of gastric content which is not moved forward to your duodenum, client mo, magsusuka. There's no way, there's no other way, there's no other exit but to go back up. Okay? Obstructing your fibrosis and even your edema and even your chronic inflammatory reaction as a result of that ulceration. With your scarring, it's not going to be as effective. Kasi wala ka nga mailabas, di ba? Hanggang doon lang siya sa stomach mo. Ang nangyayari dyan, you will have your vomiting, you will have your feeling of abdominal bloating, you will also have complaints of your nausea. And since ikaw na merong pyloric obstruction, wala nang ibang, mo na siya lahat. You are also going to have to deal with your metabolic alkalosis. Bakit ka mo? Nilabas mo lahat ng hydrogen ions mo doon sa suka. Anong natira doon sa stomach mo? Is going to be, bicarb, hindi ba? Okay, less na yung hydrogen content niya. So you're going to have to deal with your metabolic alkalosis. Okay? And apart from that, you're also going to lose your electrolytes. Okay, apart from having your hypovolemia, kasi nga nagtanggal ka or you have lost your fluids by way of your vomiting. Apart from that, you're also going to lose your hydrogen ions, causing you to have your metabolic alkalosis. And aside from that, in addition, you're also going to lose your electrolyte potassium. Alam mo yun, again, parang jackpot eh. Lahat tinanggal mo na. Wala kang magagawa dyan. Kasi nga, ayaw mag-open ni pylori. Next, we have, so there is inability to adhere to therapy. Hindi na niya sinusunod. Alam niya na meron siyang PUD. Kaya lang, hindi niya pina-follow yung protocol. Hindi niya ang intractable disease for your ulcer is likely caused by the ingestion of your Nsaids. You know in your heart that you have ulcerations, and you have been you have been informed that your Nsaids has a side effect of gastric irritation. And if they are taken in large amounts, that gastric irritation will likely result to your gastrointestinal bleeding. Okay, use of NSAIDs. Sabi ko nga kanina, kapag bawal, gusto ng mga tao. So, even if you know the things that you need to avoid, what happens is that this breaking the rules. One of which is for patients who have your PUD, pag sabi nilang, okay na ako, hindi mo na kailangan yan, ayan, magkakaroon ka ng intractable disease to the point that you become non-responsive to your normal therapy, normal management of your illness because, yun nga, pasaway ka. Yung use of NSAIDs natin is also one of the reasons kung bakit nagkakaroon tayo ng gastrointestinal bleeding. May mga pasyente kami doon sa clinical area na nagkakaroon sila ng GI bleeding because, number one, they are alcoholics. Number two, they have your overdosage. Abuse of your painkillers. Yan yung nangyayari. Another thing is that you have also the use of your drugs. These particular types of drugs which are considered gastric irritant, they come in the form of theophylline. Maalala ninyo?
Bronchodilators, ma'am.
Anyone? Yes, they are your bronchodilators. Okay, bronchodilators. And you also have your corticosteroids in the form of your zones, dexamethasone, prednisone, methylprednisolone. Okay, those are your medications. And you have your caffeine, your coffee. They are these substances which stimulate hydrochloric acid production. Gas ang ulo. And this is what's happening with your intractable disease. In the latter part of your disease, you do not respond already to your treatment because na-tolerate na ng katawan mo all of these things that you need to avoid. Okay? Next is we have your H. pylori infection, which can be transmitted from one person to another. And we also have your genetic predisposition of your PUD. Kapag meron PUD sa family mo, malamang 50% doon sa pamilya mo, mga kapamilya mo din, might also be developing your PUD later. Basta malaking factor familial disposition with your ulcerations or even your intractable disease relative to your PUD. Now, these are your manifestations. I have mentioned in passing earlier your manifestations for your PUD, but ito, okay, ang physical manifestations in detail. You will have epigastric tenderness. Masakit po sa tiyan yan. Location of your pain would be midline between umbilicus and your xiphoid process. You will also have your hyperactive bowel citric acid. Mawawala yung ating hyperactive bowel sounds, yung intestinal lining. You also have your dyspepsia. Your dyspepsia is pain, okay, as a result again of that regurgitation or of that acid release or acid secretion. In your gastric area, I've mentioned that sabi na it might be relieved by food, but actually no, it's not. Okay, it actually aggravates your client's pain. With your duodenum, I have mentioned earlier that it occurs 2 to 3 hours after you have ingested something, right? Because of that pain, and it is foods that need to be avoided, like for example, your spicy foods, your onion, your alcohol. Yan. You have your coffee, you have your between your manifestations and signs and symptoms of patients who have your gastric and duodenal ulcer. So, apart from that one also, for both, there would be complaints of your vomiting. Kasi nga, di ba, ang daming ang natira doon. I mean, there is so much of your gastric acid secretions. Appetite might be maintained. This is for your duodenal. Okay. Unless, of course, if there is your pylorus hematemesis or there is your emesis. If bleeding, it is very important that you monitor your vital signs, most especially your blood pressure, because you would like to assume that the patient might be having your hypovolemia. Okay, hypovolemia. Watch out for hematemesis and meningitis. Bilirubin and your hematocrit. These two are one of the most important